This video illustrates the usage of a novel image guidance system for a laparoscopic ablation of a 2 cm hepatocellular carcinoma located in segment 7. A 55-year-old male presented with a 2 cm hypervascular segment 7 lesion consistent with HCC. The patient had chronic hepatitis C and had not undergone prior therapy. The preoperative surgical plan was laparoscopic RFA guided by ultrasound. This is the preoperative arterial phase CT scan. Note the hypervascular lesion in segment 7. Upon laparoscopic examination of the abdomen, the liver was observed to be cirrhotic with evidence of portal hypertension. As a result, resection was contraindicated. The operation was performed as follows. First, the liver was examined with laparoscopic ultrasound. Next, an image guidance registration was performed. Then, registration accuracy was confirmed. The RFA needle was positioned based on image guidance. The RFA needle placement was then confirmed via laparoscopic ultrasound. The RFA tines were deployed for a 10-minute ablation. And finally, the ablation zone was examined via laparoscopic ultrasound. First, hepatic veins and portal pedicles were used to locate the region where the tumor was visualized on the preoperative CT scan in segment 7. After extensive examination in the operating room, no tumor could be identified with ultrasound. Next, a registration was performed with the image guidance system. The guidance system consists of an optical tracking camera, a navigation interface that can be viewed on an external monitor, and various tracked instruments. A laparoscopic localizing probe was inserted through a trocar to identify anatomic features and the surface of the liver, all of which were segmented from the preoperative images. Here, you can see the surface points being acquired as the probe sweeps across the liver surface. This registration maps the preoperative images to the intraoperative liver position, enabling real-time instrument tracking relative to preoperative CT or MR images. Once the registration was complete, the registration accuracy was confirmed by identifying known features and observing the guidance system interface. Features such as the gallbladder fundus and the falciform were used in this particular procedure to confirm accuracy. The laparoscopic probe was then used to identify the area near the tumor using the 3D models and CT scans as guides. The lower right quadrant displays an axial view of the arterial phase CT scan. Here, the tumor is displayed on the CT scan, indicating that the tumor is located in close proximity to the needle tip. Next, the RFA needle was placed based on image guidance. The green probe and crosshairs on the tomograms reflect the RFA needle tip position as it traverses through the liver. Final adjustments to the needle tip position were made based on a combination of image guidance and ultrasound. The RFA needle tip position was then confirmed via ultrasound, using hepatic veins, portal pedicles, and the liver capsule as landmarks. Next, the RFA tines were deployed per the manufacturer's instructions for a 4 centimeter ablation zone, and the ablation cycle was initiated. Finally, once the 10-minute ablation cycle was complete, ultrasound was used to examine the resulting ablation zone. A CT scan performed 2 weeks after the date of surgery demonstrated a 3.2 by 2.7 centimeter ablation zone with no evidence of local recurrence. Here, the preoperative and postoperative images can be viewed side by side.